All federal employees have until November 22 to get fully vaccinated for COVID-19 without the option for just testing. The White House says that deadline applies to both agencies and federal contractors. Robert Shea is National Managing Principal for Public Policy at Grant Thornton. He's former Associate Director at the Office of Management and Budget. Eric Crusius is a partner at Holland Knight. Welcome to you both. Eric, let me start with you. What does this mandate mean for federal contractors?
It really means that contractors kind of have to get systems in place, compliance systems in place to be able to track employees and understand what their vaccination status is and do it in a way that's legal, because there's a lot of kind of legal barriers that when you're collecting health information. It's interesting because we have a situation where there's a task force that's coming out on September 24th with the requirements, including vaccination, and the executive order that came out about this issue didn't specifically mention vaccination, but the White House website has already been updated to say vaccinations will be required for contractors.
Is this only contractors that are going to be on site at federal properties?
It will also be contractors who have employees working on their own sites. And then the question is, with COVID-19, is your home also a work site if the company is mandating folks work at home? So that's something that hopefully will be ironed out by September 24th.
The president has also said that companies over 100 employees have to get their employees vaccinated. So I guess any federal contractor over 100 employees would be required, right, to get their employees vaccinated?
Probably. There'll be some companies that get the mandate from two angles, from this executive order and then this emergency temporary standard that OSHA is probably going to release imminently requiring vaccinations.
So, Robert, let me ask you about how this vaccine mandate would need to be written into contracts then for the federal contractors that are working with the government?
That's right.
How does that work?
Eric alluded to the way the executive order was written. It called on the task force to issue guidance that the director of OMB needs to approve, and then the Federal Acquisition Regulation Council, the FAR Council, needs to craft the terms and conditions that will go actually into contracts that then require the contractors to take action. So there's a lot of bureaucratic wrangling that will have to take place before you actually see these things reflected in contracts. My advice to contractors would be to get ahead of this, get their workforces vaccinated, because it looks like those requirements will be here sooner rather than later.
But I wonder if it's sooner rather than later, because that seems like a lot of work, to be honest, and it's not like the government works that fast.
That's right. They don't generally work fast, but I think the president has made it clear that he wants this mandate imposed in whatever facet of the economy he can influence. And federal workers, federal contractors are two workforces over which he does have significant influence.
Do you think agency leaders are equipped enough and have enough information to get everything they need to put in place to meet the deadline?
I think they have a lot of processes in place to test their employees and visitors for COVID. And they have done yeoman's work getting their workforces vaccinated. The task force guidance that came out this week adds further clarity on what's required under the president's recent executive order. But there's still a lot of discretion. All federal employees will have to be vaccinated unless there's an exception allowed by law. And the courts have generally been the ones to determine what's actually a reasonable exception that you can offer employees.
You know, since you mentioned it, I do want to talk about the exceptions, because I feel like that's going to be a legal landmine. You know, somebody saying, well, I have a religious issue with the vaccine, so therefore I don't have to get it. And
I think Eric will confirm for me that the courts are the ones to determine what constitutes reasonableness. A vaccination requirement has generally been upheld, but the wiggle room has been in just what kinds of exceptions. Is there a health exception? Is there a religious exception? And the courts really do weigh the health benefits of a vaccine versus what constitutes a genuine reason not to get one.
Eric, your thoughts on the exemption?
Yeah, I think Robert's right. This is really going to play out in the court system. And courts have generally, from what I've seen, and there haven't been a lot of cases on this, but generally kind of look at those exceptions pretty narrowly. So you really have to put up a good show of proof that you're entitled to that exception. And it's going to be even more difficult because the government's going to move pretty fast. One, this whole regulatory process that Robert was talking about takes a long time generally. But there is one thing in their arsenal that the government has that they ordinarily don't use but can use it here, and that's called a class deviation. And essentially what can happen is the government issues a class deviation, an agency issues it, and all of a sudden it's a kind of a regulatory requirement until the regulations come out. So the executive order alluded to the fact that President Biden wants class deviations to be used. So it'll be interesting to see if DOD and other agencies use class deviations to kind of get it in quicker. That makes the court process even more complicated.
Robert, I want to ask you how this mandate is different, if at all, for agencies and for contractors.
Well, right now, federal agencies, contractors, and contractors that work on site at federal agencies are different in that there's no requirement that federal contractors get vaccinated, at least until the executive order that was recently issued. And so the real impact was for contractors that were visiting federal agencies. They had to either show they were vaccinated or agree to be tested. Now, all those populations are going to be required to be vaccinated, though the difference will be in the timeline. The Safer Federal Workforce Task Force has already issued guidelines impacting federal employees. Those impacting contractors are yet to come, and as we discussed, there'll be regulatory actions that have to take place before those requirements get embedded in contracts. Now, one of the wrinkles is that the guidance says agencies continue testing at their discretion. So it'll be interesting to see which agencies require, in addition to vaccinations for their employees and contractors, testing of those employees and contractors as well.
And certainly places where they're facing the public, that would also be, or healthcare agencies like the Veterans Administration, NIH.
I think that's right. Those that have high public impact, contact with the public, those that are actually delivering health care, those are populations that I think you'll see belt and suspenders like testing on top of vaccination requirements.
Eric, we talked a little bit about lawsuits. There's lawsuits popping up all over the country about the mask mandates and vaccine mandates. Will that impact our conversation here about the federal workers, the federal contractors?
I mean, it could. It only takes one federal judge to issue a mandate that could impact the entirety of the country, although historically these lawsuits have been unsuccessful. I mean, I think the difficulty that contractors have with this is they'll possibly be facing lawsuits themselves. And then there are these different standards that you could see across different agencies, where some may have a testing mandate, some may have a more stringent vaccine mandate, and they have this population of employees where they're all going to have different requirements for these employees. So not only is it difficult for contractors to track, but the employee population may get a little bit upset that some employees have a vaccine requirement and some don't, whether they're in favor of vaccines or not. Maybe they'll be mad that their cohorts don't have a vaccine mandate because they don't want to get the vaccine and vice versa. So it'll be interesting to see how all that nets out and how that plays into the potential lawsuits if employees are not being treated kind of equally.
So on the contractor side, what's really still up in the air? What's still yet to be determined for them on this mandate?
Part of it is the date. So there technically has not been a vaccine mandate announced for contractor employees, but it's in the cards. Everyone knows it's happening. The White House has updated their website already to say that it's happening. But we don't know the date that mandate's going to take effect for contractors. We should know September 24th when the official task force guidance is released, what that date is. And then from there, contractors have to kind of get all their employees together and figure out a solution, because if there is a population of employees who are not willing to abide by that mandate, they have to find replacements for them on their contracts.
I wonder, are we expecting an exodus of employees who are saying, you know what, I'm not getting vaccinated, and if that means I lose my job, I'll go work somewhere else, or I'll retire, whatever?
Right. I mean, it's possible, especially the retirement angle. I think what the Biden administration is trying to do is to not give them a place to go to if they want to go somewhere else. So with this requirement where if you have 100 more employees, you're going to have some kind of mandate. We're waiting for that guidance to come out. But if every if the person's skill is doing X and all jobs doing X require a vaccine, perhaps maybe they will stay and get the vaccine. So it'll be interesting to see.
Robert, what are you looking for from the task force? What extra guidance for agencies are you most interested in finding out?
I think the biggest mystery is on exceptions. Where will we allow for exceptions to the vaccine mandate? And right now there are no clear instructions for agencies on that question. I will emphasize that the sooner the bulk of the population, including these workforces, are vaccinated, the sooner the vaccine mandate becomes irrelevant. That's really the goal of all this, to get the pandemic behind us, and the vaccinations are the best way to do that.
Eric, what about product contractors? Is there anything particularly vague about the mandate when it comes to them?
Yeah, it's interesting you bring that up because there is some vagueness associated with it. Within the executive order, there's a list of contracts that are implicated by the executive order, and there are a list of types of contracts that would be excluded. Specifically excluded are subcontracts for products. But if you look at the list of contracts that are included, there's nothing there that indicates that prime contracts are included. So you have these large contractors that sell products to the federal government, and they're not on either list. And it sounds like there's maybe a little bit of tug of war behind the scenes as they try to figure that one out. But it'd be, that's a large portion of the employees who do work for the, as contractors for the federal government. And this also includes, of course, these employees who are working in connection with a contract, and they help support the contract. And in the product space, that's a lot of people. So I'd be interested to see if these product prime contracts are added to that goal list, or if it's made more clear that subcontracts and prime contracts for products are excluded.
Well, clearly, gentlemen, more is going to come out before this whole pandemic is over. So I want to thank you so much. We'll continue to watch this issue.
Thanks for having us.
Thank you.